Artificial intelligence can make an impact in cancer treatment by empowering clinicians and patients with personalized and scalable AI co-pilots. Now, this was the conversation Arise business analyst Rotus Oddiri had with two executives from Hurone AI, a player in the health tech sector. We have Dr. Kingsley Ndoh, who is founder and CEO of Analise, LeJeune-Stodieck, head of business development, speaking to Arise News in Riyadh at the Future Investment Initiative. Let's have a look.
All right, Arise News here, of course, in Riyadh, Saudi Arabia, the 9th edition of the Future Investment Initiative. And I'm so happy that we're having a technology conversation today, because today's sessions are just full of tech, particularly on artificial intelligence and all the use cases for AI. Arguably one of the most important, maybe not arguably, the most important one is healthcare. And we're happy to be talking to two executives from a company that is focused on healthcare, particularly cancer research and how AI can improve it. So it's Hurone AI, and we're happy to have Dr. Kingsley Ndoh, who of course is the founder and yes of the company, and Analise LeJeune, who is the head of business development at Hurone AI. Thank you both for joining us and talking to Arise News. We've got to start with a background for everybody that's watching so they know about the company. Let's start with what it does. What does Hurone AI do?
So we could start from the problem. Cancer is a huge burden in our world. I mean, 40% of Americans will have a cancer diagnosis in their lifetime. And when you look at the burden the patient faces and the number of oncologists that are available to address those problems is few and far between. And a lot of cancer care happens outside the hospital. So from the time you have that first diagnosis, you're already overwhelmed with even that diagnosis and all the things you have to do. And then we have the treatment, which is, we have surgery, immunotherapy, chemotherapy. And so patients have to deal with a lot of these things alone. And there's just not enough healthcare workforce to manage all that. And so our technology comes in this gap where the patients have to navigate side effects. They have to navigate when to take their meds. They have to navigate even social resources. As you know, cancer is very financially toxic, very expensive. So patients will need, sometimes will struggle with housing, will struggle with treatment co-pays. And so think about our technology as that co-pilot that helps the patients through this journey. So it could be like Hurone, which is the name of our product or app. Hurone just talks in natural language to these patients, is connected to their health records, understands the patient, and really navigates them through that healthcare journey. It tracks their side effects and their symptoms. And then on the other hand, there's a human in the loop. So the hospital care team or the cancer care team can see what is happening with their patients in real time. And so they know when to escalate things. Hurone can even say, this is an emergency, call 911. And it has memory. So when a patient has a conversation with Hurone today, if they're having a conversation the next day, it tells them how was the conflict you had, how are you faring today, right? So it keeps getting intelligent, and that's really one of our big modes. So think about us as that co-pilot that really navigates the cancer patients so that we can achieve much better patient outcomes and reduce the work burden of the healthcare staff and the healthcare system.
Fantastic. Analise, can you speak towards, I guess, the productivity side of this? Because I guess the whole conversation around AI is how productivity gains, improve output. So how does that translate? Just piggybacking off Dr. Ndoh's answer there. How does that translate to what you guys are doing?
Yeah, absolutely. So I think we look at a couple different axes. There's the efficiency gains for the hospital, for the care team, et cetera. There's a lot of different areas of care that could be made, a lot more automatic. So, for example, things that don't necessarily need to be escalated to the care team, because we want to see the care team essentially focus on the things that are of, higher importance, that are more complex, that require a lot more human, kind of care and empathy and trust and all of those pieces. And so if we can get the care team focusing on those pieces, then higher value to the patient, but then also value to the hospital, because there's all of these efficiencies that can be automated. So, for example, we see that different doctors and surgeons get a ton of in-basket messages, which is essentially when patients are reaching out for a lot of different things, and we want them to be able to reach their care team, but we also know that a lot of things can be handled by our solution. And so then what we see is really important is that there's still the ability to escalate and to for anything that does need to be escalated, that the patients can get a hold of their care team, but that we're really triaging and helping the hospital be more efficient in those ways. So that's just one example, but we want to see increased value to the patient, which is difficult right now, especially with how dynamic the different healthcare environments can be, especially in the U.S. The federal state is changing rapidly. And so for health systems, it's really important that we help them figure out ways that we can still deliver value to patients and to their end user, really reduce some of the difficulties for their care teams in this environment, but, maintain those high standards.
Okay, great stuff. Now, gotta talk about money for the both of you. There's a lot of capex that's just going into artificial intelligence. It's big announcements and so on and so forth. So, Dr. Ndoh, how do you how is this supposed to earn money for the company and so on for you to how does it work? How does that work out?
So like Analise and I have mentioned, first we're already providing clear ROI to healthcare systems. Our business is a B2B2C. And so we're working with several large healthcare systems in the US, and one of them is the University of California, San Francisco, also known as UCSF. And in their brain tumor center, we were able to show that we can reduce 80% of the in-basket messages. Think about this. A healthcare team has like 30,000 messages to respond to that patients are all like anxious. And with Hurone, it just does that like naturally, right? And so you wouldn't need that amount of in-basket messages to respond to, except for the complex ones that we need that human in the loop. So hospitals see that as, money saved, because that's many, many expensive hours of healthcare workers. And that ties into enterprise models that you pay a license and you save just a lot of money. The other place we see efficiency gains is that patients engage better with the healthcare system for a longer time, and they're much more satisfied. And every healthcare executive is very concerned about like patient satisfaction, patient engagement, because if you're losing that credibility from your healthcare system and patients are just being dissatisfied with care and moving to other healthcare system, that is loss of revenue for hospitals. And better patient outcomes is really critical for hospitals to continue to maintain their credibility, maintain their brand value, and that's what we bring. And to payers, we've heard in this conference, there was a session on health insurance, and we're seeing how inflated those figures are. Payers are really struggling to see where their margins are. And when I mean payers, I mean insurance companies. They're really struggling to see where their margins are. And cancer is the most expensive chronic disease we have, right? And there are big ticket expenses that these insurance companies deal with, like they deal with admissions, readmissions, or even emergency situations. And so with Hurone, reducing the amount of those encounters, it's just clear value to payers. And so this is where reimbursement models, come in. So essentially, back to your question, when we are paid through reimbursements by payers and enterprise licensing deals.
Fantastic. Now, Analise, let me come back to you. We're here. I want to talk about this future investment initiative. You had a business development goal. You're talking to a lot of potential investors here. Can you guys talk? And I know you have you're also going to be part of a session here as well. Can you talk about this environment and folks you've been talking to, and whether you're doing capital raising or talking to investors, and what that's been like?
Yeah, absolutely. So it's been really great. I think that one thing we love about this, event, it's just all of the different backgrounds and expertise coming together to talk about this really important topic. We both come from more of like the healthcare background. And so that's where I think we're seen as kind of insiders within the healthcare system that are tech second. We see that health and the patient as number one. So I think that's kind of the unique perspective that we bring to a lot of these conversations. But, looking at the broader macro kind of trends of AI and all of these different pieces, it's really important that we have our eye on the ball with where all these pieces are moving to, not just for our own moat and durability in this space, but so that we're really bringing the best that we can to our, clients, to our investors, and all of these kind of end users. And so, that's, I think, really why we're seeing this event as such an exciting place to be. We are currently raising capital. We're in our seed round, so we're still fairly early stages, but it's been a very exciting. As Kingsley mentioned, we have some pretty strong partners that are very top national cancer institutes, and so we're really moving forward with them pretty efficiently. And at the end of the day, I think we're looking forward to closing around soon.
Okay, fantastic. They got to, yes, please,
So out of the whole, even for our stage, we're already post-revenue. We're working with some of the largest cancer centers in the US. And, one of the things I really love about the environment here is an intersection between policy, business, operators, venture capital, private equities. It's just amazing. And part of my background, besides being a clinician in my former life,
yeah.
I advised the President Biden's cancer panel on cancer navigation technologies. And part of the work that came out from that was the approval for CMS. CMS is the Centers for Medicaid and Medicare in the US, for CMS to reimburse for cancer care navigation technologies. So it's really a great space to be because we're looking at an intersection of where we both walked in, and we're meeting with some incredible people. And I hope you've heard our panel. We're going to check it out today, where we're talking about the future of AI and hospitals. It's going to be amazing.
Perfect. Now, let me pivot there to Africa, right? You've got a large Nigerian audience, and it's great that you of course are Nigerian. You also have a lot of experience dealing with healthcare in Nigeria, which is great. How the U.S. healthcare system, of course, it's had its own issues, but it's pretty advanced, right? In terms of the universities and so on and so forth. So, how can this model work in Africa or in Nigeria? What's your outlook with how that can work out?
I think there's a huge opportunity in Nigeria, and I know that it's already just overstated. We only see the huge potential, the huge opportunity, but there are certain things that need to be in place for this potential to be realized. AI will have the most significant impact in Africa, but we need a few things. We need business models that work for hospitals, even at the government level. We need insurance companies that are looking, both from the government and private insurance, that are looking to models that reimburse for cancer care technologies, and just more investments in digitalization, especially electronic health records. Like you mentioned, our platform gets intelligence because it's connected by consent with the patient to their records. If you don't have that foundational infrastructure for data, for the patient's data, then that AI cannot be intelligent. As you know, AI is only as good as the data it has. So those are it has huge potential. Our company actually have strong roots in Africa. We first trialed in Rwanda.
Oh, okay.
And we didn't just take a US model to Rwanda. We co-created to adapting into that environment. So instead of just using smartphone apps, we use things like USSD. We customized to Kenya, Rwanda, which is the language there. And our trials were quite successful. It was even mentioned by the CEO of AWS, who was AWS was one of
Amazon Web Services. Yeah.
But to scale these technologies in Africa, we need business models that work.
Yeah.
And it's a process, but we'll get there.
Fantastic. Yeah, please, Analise, you want to chime in?
I just might add, I think the electronic medical record piece is just so important. And so I think one thing we're looking forward to is looking at how we can structure something with, a country like Nigeria, or hospital systems within it, where if we could show the, return on investment that these hospitals can get, because we understand that, of course, the budget is always the biggest and hardest piece of it, right? where, if we can help them kind of see the end goal of like we can digitize some of this, then how we can then come in and help see some return on investment, which hasn't always been possible before, frankly. We know that there's a huge shift happening right now across the continent in terms of cancer rates, a lot of chronic conditions, but cancer predominantly is increasing greatly. The healthcare systems are really not, necessarily built for that. It was more infectious disease for a long time. And we're seeing that epidemiological shift all over the world. But we're very interested to see, where we can be a support to that. I think that's really what I got interested in AI in the first place is, there's such amazing potential for healthcare systems like those in Nigeria. And we're excited to really dig in and think about those, different structures and how we can make it worth it for those investments from.
Fantastic. Final question for you, Doctor. Let me round off. This is cancer research. Can this platform be used elsewhere in healthcare? What's the future? Are you going to pivot into, what is that looking like?
Yeah, so Hurone is going to be that company that is really the best at navigating chronic diseases. We're starting with the oncology vertical because we want to be the best in the world in that. And with the key adoptions we have with oncology and the learnings, we are going to eventually expand to all chronic diseases, including rare genetic diseases. Yeah.
Great conversation. Dr. Kingsley, Ndoh, and of course, Analise, LeJeune, founder, Hurone, head of business development. Thank you both for talking to Arise. We appreciate your time.
Thank you so much. Thank you. Really appreciate it.